When your family's in need of medical care, where should you turn? Come to Englewood Hospital, home of the most advanced technologies and medical equipment. Home to Magnet Award-winning nurses who deliver compassionate professional care. And home to more top-rated doctors than any other hospital in North Jersey. For your family's health, come to Englewood Hospital. We're closer than you think.
Good evening. Welcome to Dr. Gore's show. Today we're going to talk about a very unusual topic, the psychosocial aspect of immigration. At some point in time, we all came, either us or our children, our parents, our grandparents, or our great-grandparents came to this country or to the other parts of this world, and they immigrated. Everybody was excited, new land, new opportunities, but came some psychosocial aspect of that stress. And to talk about that, we have a very distinguished speaker and a great friend of mine, Dr. Bharti Palkhiwala.
Hello. Hi.
Dr. Palkhiwala did her training in India, and then she immigrated to New Jersey, where she did her training, and she's been practicing as a board-certified diplomat in psychiatry and neurology in Bergen County, New Jersey. So, Dr. Palkhiwala, you have this vast experience, and most of your patients have either immigrated or have some, but in their family who's immigrated, and you do see this issues in your practice.
Yes.
Now, there's a lot of excitement when we come, but as the time goes by, we have to do some adjustments. So, is the stress and anxiety and depression and all those related effects of immigration, do you think the trend is increasing? Is there any study? Do you have any numbers to tell us?
Yes, definitely the trace has been increasing. Of course, I could tell with my experience in 1960s, a lot of people immigrated. But as you go by until now, in 2000, more and more people are immigrated,
right,
especially Indian. Young generation, even they're bringing their parents, nephews, nieces, and there's great amount of Indian people in the United States,
right,
especially East Coast and West Coast. Years ago, I did not have any Indian patient in my office.
Okay.
But as the time goes, I see more and more Indian patients, especially when they call, this is, I have an anxiety.
Mm-hmm.
This is, I don't know, I cannot function, it's too much.
Mm-hmm.
Or especially I hear from the young generation, I'm stressed out, I cannot
Correct.
take this.
Correct.
And then I'm looking into that. Immigration has special issues.
Mm-hmm.
When they come to this country, they have to adapt to this country.
Correct.
This is different environment,
Mm-hmm.
different adaptation. Work system is different. They have to adjust. It's not the same
Correct.
government job what you had in India.
Mm-hmm.
This is whole system is different. Patient want to practice their own. The different issue of setting out your practice.
Correct.
When in India you are setting a practice very differently.
Correct.
So to make all this adjustment, new environment, new work,
Mm-hmm.
and all this causes extreme stress.
Correct.
Common people
Correct.
use the word stress. And what is stress? Stress is not able to relax.
Okay.
You have no time for yourself.
Okay.
You feel overwhelmed. You cannot able to concentrate.
Mm-hmm.
That is what people call as a stress. In psychological practice, I could say that these are the factors where they're not able to relax.
Correct.
Not able to function.
Correct. So, as me as an immigrant to this country, I can say that once you come to this country, not only your lifestyle is changing, your eating habits are different, the availability of food is different, the home situation is different. You don't have the support system of your parents, your friends, your sister, your brother. So that social circle is gone now, mm-hmm. that you usually fall back on.
Correct.
But also your culture of work is different. You want to fit in to this culture, but you want to retain your identity as well. So I think there's a lot of things happening in your mind that you want to do certain things, but you can't do it. And sometimes you don't want to do certain things, but you have to do it because that's the requirement. So do you see that struggle, usually in the woman, don't you think, that they have to adjust their life?
in a woman especially more affected with the stress because she's trying to balance her work at home. When she goes out, it's a different kind of a stress on her to prove herself and whatever she's doing. When she come, even dressing. When you go to work, you dress differently. When you come home, you want to dress differently. You have your responsibility at home. You have responsibility of the children. And a woman, especially Indian woman, takes it. She wants to do everything right. She thinks she has to do it. She cannot say no. She cannot say to her husband, no, I'm so tired today, I cannot do it.
Right.
She feels she has to do. So she's more and more stressed about this. And sometimes all of us start feeling like where we belong. Are we Indian or what are we doing? Are we going to lose our culture? Are we going to lose our identity as being Indian? And that's what really kind of bothering. Most of the people get bothered with that, where what is going to happen. And we had to work on with this. We need to accept certain things we're going to lose, certain things we're going to gain.
Correct.
And everybody starts working on this and finally comes to the term, okay, this is what it is, and then able to relieve the stress.
Correct. So I think apart from us as an adult, I think the children do. There are friends of mine who came with children who were 5 years, 6 years, or little ones. They were used to a different society back home.
Correct.
And now they have to live in this different society where the expectations are different, lots of restrictions, starting from wearing the seat belts to where they can play, playground, supervised play dates. So you see that aspect affecting children as well.
Yes, actually the parents feel every moment they have to keep their children engaged. They need to be supervised. In India before that, they go outside, they play, and parents are doing work at their home. That's fine. Here, I think you cannot leave your kid alone. Even you have to decide, you have to be very careful how you talk to your child.
Correct.
The children are very smart here. They misunderstand sometimes. If you're real angry, they say, oh, my mother is very angry at me and she's abusing me, even you go to that extent.
Right.
So you have to be really, really careful. Of course, you want your children to grow up properly, so you have to pay attention whom they're hanging out.
Correct.
We have also fear if they get too much freedom or with hanging out with some unknown people, they might go in a wrong
direction.
Absolutely. And we all should watch. The drug problem is a big problem in this country, even other countries. Other people need to watch whom your children are hanging out with him. Even you have to be friendly with other children's parents also. So you want to know what the different cultures are.
You want your child to mix. You don't want them to be isolated also.
Exactly.
So you want them to mingle.
Right.
But I think the other thing which is coming strikingly, we used to always worry about the drugs and the hanging out of our kids. But recently there has been so many news of criminal activity of our immigrant kids. And that's something that we don't talk about. But I think the gun control, the violence also is rising in our culture.
Right.
Who are immigrated here. So I think that's something that...
And that's becoming really shocking.
Correct.
Because we always think our culture is very nice and we sometimes very naive. We don't know what's going on in your children's mind. So you need to know your kids. And wait to know your need to kids, you need to communicate.
Correct.
Spend time with your child. Have a dinner with them. Find out what's bothering them.
Correct.
Why child will go in a wrong direction? Because he's bothered.
Correct.
He's not happy with whatever he's had, and then he could choose a wrong path.
Correct.
So talk
and
to
especially
him.
when they move as an immigrant kid, they want to fit in the society. So sometimes they do think under peer pressure to prove themselves that yes, they are like the others. But there is a limit to what they should do and what they shouldn't do. You don't have to do bad things to prove that you fit in.
Exactly.
And I think that's something that we as an adult has to make sure the kids who have recently immigrated keep that in mind.
Right. Actually, I would tell you my experience. I live in Paramus and I belonged to a mayor's committee called Substance Abuse Prevention Committee. And this is one of my friends recommended me and I was glad to join that. And what was the purpose of the principal is to get Indian community aware of the facts that Indian kids can also go in a wrong way.
Absolutely.
So I used to have a meetings with the parents and children to have open communication, to how they spend time with their friends, what is their activity, and then we will engage them in a dance activity or some play activity, so they will stay away from the drugs and still able to enjoy their free time.
Correct. So, as we were talking about stress, which affects us, is there a definition of stress? Is there a symptom, a sign, a physical, condition that can lead to due to excess of stress?
Just in layman's term, people say that not able to relax. But as you see that, as definition, stress may not be sometimes able to recognize. They said, I cannot do things. And then it start affecting your body.
Correct.
So there is the symptoms of body, like physiological symptoms.
Correct.
Because of stress, you start getting a headache, you getting palpitation, you can have GI gastrointestinal symptom like nausea, stomach pain. I have one lady, she was under a lot of stress, and she says something is really bothering me. I have pain in my stomach. And I end up sending her to the gastroenterologist. And actually everything was negative. More we talked about it, she was under a lot of stress. She was not able to function. But her symptom only showed up that I have a stomach ache. So, that lead, it's
ongoing
not
stress can lead to blood pressure issues and
Yes.
cardiac issues because of all that stress and anxiety, and steroids leading to vasospasms and arterial issues. So it definitely has a long-term consequences. Now, apart from the stress, the stress can lead into either anxiety or depression if it's ongoing thing. How do patients come to you with anxiety symptoms?
Sometimes patients just make a phone call and say that I have an anxiety problem. Usually it's a safe way to say that I have an anxiety. I will ask them, and do you have any other drug problem? You have any depression? And they will say no. But when they come to my office, when I explore that, they have much more other symptoms, even the depression. Because the depression symptoms can be like they're not interested in things they used to do before.
Correct.
They say, I am laying down in my bed, I don't want to get up in the morning and to go to work.
Correct.
I have to push myself.
Right.
I'm not able to sleep right. I cannot have enough sleep. I feel tired. The things he used to play tennis every day. Now I don't feel I'm going playing tennis anymore. I have lose interest.
So you lose interest in things that used to make you happy, things that you used to like to do, and now you don't want to do it.
That is really a key symptom of depression.
But also they can have issues with sleep and food, correct?
Yes.
Either they stop eating, or lack of sleep, or excess of.
Sometimes they can be excess. Sometimes they're sleeping more, even though they're not good, well sleep, but they will lay in the bed. Sometimes they're overeating, like don't care.
Right.
Sometimes they don't eat properly and lose weight. And that can lead to other medical symptoms.
Correct.
Even the same thing as anxiety, the hypertension, angina, palpitation, panic attack.
Correct.
A lot of doctors, the patient says, I have a panic attack. I cannot breathe. I feel like I have a heart attack.
Right.
And they end up in emergency room. In the emergency room, they do EKG, cardiac workup, and everything is negative.
Correct.
And they tell them you have a panic attack.
Right.
There is probably you saw the movie Analyze This, where the person who was under actor was under pressure, and he ended up in emergency room, and that was stress related.
Correct.
The same thing could happen to us. Because of stress, you have an anxiety. Anxiety can lead to a lot of physiological symptom, and that can end up you end up having medical checkup.
Right.
And actually, you need to find out what's happening psychologically with you.
What's the root cause of that?
Root cause of that, so that you can able to take care of that.
Correct.
So, even they come with saying that anxiety, we go deep down and really motivate them to get the treatment for that.
Correct. So as we've talked so far, when we come to a new country, there's immigration, it's a new language, it's a new culture, you have to adapt to your work, adapt to your living situation much more. stressed nowadays because of the economic changes in this country. People are losing job, even though they come with a job, they don't have job. Now you don't have money, you don't have savings to fall back. So all this can lead to a great amount of stress, leading to anxiety and sometimes leading to depression. We're going to take a short break and we're going to come back, how to manage this and what can we do. We'll be right back.
When your family's in need of medical care, where should you turn? Come to Englewood Hospital, home of the most advanced technologies and medical equipment. Home to Magnet Award-winning nurses who deliver compassionate professional care. And home to more top-rated doctors than any other hospital in North Jersey. For your family's health, come to Englewood Hospital. We're closer than you think.
Welcome back. Today we're talking about psychosocial aspect of immigration, and to talk about that we have Dr. Bharti Balkiwala with us. We've so far talked about the effects of the stress and anxiety and depression, especially with a new immigrant, and also over a period of time this can build up with change in the situation, especially with this economic situation in this country. So going back to what we were talking, Dr. Balkiwala, is there a difference that you find, because you see both men and women, do you find there's a difference the way women present with the stress or depression compared to men? Are they more willing to come? Is there a difference?
Okay, let me take a little one backstage. Like we said, economical things are changing now. There is more and more demand. So there was a study in 2012 by Carnegie Mellon University study, and it's just measure the stress across country-wise, and compared to last 25 years to 2012, the stress was highest.
Wow.
High was in women was 18% and men was 25%.
So the men do suffer.
Yes, and this was on ABC News also.
Right.
So, and especially the immigration, it's almost, I feel, double.
Right.
With my experience, clinical experience, I see this. More and more people are stressed out. They are in a double jeopardy now. They recognize their stress, they want to come for help, and their economic situation is bad. They don't have health insurance, or their health insurance co-payment is high. So it's like a double thing. Should I go for help, or what should I do?
Correct.
Of course, I encourage them. There are a lot of free clinics open there where they could go for help. You asked me a question about that there is a different way of presenting depression and anxiety in men and female. Yes. Man is the one, their pride, ego. They don't want to go for help. Or they think they don't need help. They can solve their problem by themselves. Even you experience probably, the man will not open up and talk, like female talks.
Correct.
And it's a good quality for the female because they open up her heart and they talk about their problems, while man feels it's a weakness. If they talk about the problem, it's a weakness. So man usually don't go for help. I have large percentage of the female who comes to my practice than compared to men.
Right.
And this could be because of their hormonal, we are built, God made us different.
Correct.
God has, our hormones are different.
Correct.
The female goes to the menstrual cycle, she goes to the pregnancy, she goes to menopause. Man has a different kind of, they don't go through all this.
The ups and downs of hormones in their cycle.
Exactly. And women, is especially the sensitive, they cry easily. So it's good to cry.
Right.
Man don't cry. Again, they think it's a weakness. The female cries, that's better, is outlet.
Correct.
Even in your movie, you will see the female will start crying if there's a sad scene, the man will hold it back.
Correct. And also, apart from the difference in men and women, I think there's a seasonal variation too, right? Do you see rise during winter month when there's no sun out, people get a little bit more, so there's some seasonal effect.
It's a seasonal effect, yes. Summer, usually people are less depressed. Winter are usually people more depressed.
The
of
cabin
course, the
fever.
light, yes. The light has definitely
a positive effect on mood.
Positive on mood. And now there are, even in winter, we are recommending to buy a lamp for the lamp for the depression. That person can sit under that lamp for like 15-20 minutes 3 times a day during winter. That will help
in the moods.
decrease of their variation in mood or get lifted out from the depression.
Right. So now this person has come to your office, you've examined them, you've diagnosed them either with anxiety or depression. Now, how do you intervene? A lot of times when I send somebody or I bring up that thought that you might need some help with either a psychologist or a psychiatrist, they like, I don't want to go, I don't have issue. They don't want that stigma. They think it's bad if they go to a psychiatrist, it's a taboo, or they'll need lifelong treatment. I think sometimes that kind of thing I want you to express to our viewers, that there's no stigma. It can be a short therapy. It's just an adjustment. So can you enlighten us on that?
Yes, stigma is a big issue. Here we've been campaigning to decrease the psychiatric stigma of mental illnesses. We
Correct.
need to decrease it. And especially I see an immigrant or Indian people, the stigma is much more.
Right.
They have different understanding about what is emotional illness. They think you have to be really, really crazy to go to a psychiatrist or psychologist. So you don't need to be. Even your anxiety, even the depression, or even you're just stressed out, you can seek help. You could go for a help to relieve that tension,
Right.
relieve that anxiety.
Right.
Yes, when the medical doctor recommend them to see a doctor, they think, no, I'm not crazy. They hesitate. So even we talk to the medical doctor saying that, explain them, this is a just evaluation.
Correct.
You may not need this treatment lifelong. It could be just regarding your situation, right? You are a gynecologist or OBGYN, and after the delivery, most of women have blues.
Correct.
Normal blues are different, but if they get more depressed, then
Correct.
they will need help.
Right.
And that has been really becoming more and more aware, especially in New Jersey. Governor Cody has a task force
Correct.
to go for a help after your delivery.
Right.
So that could be a temporary issue.
Right.
So don't be afraid to go. If it's treated right and right time and with right duration, you are okay. You're back to normal.
It doesn't have to be a lifelong
Right.
treatment.
But if you don't treat it,
Right.
then your depression is going to be worse.
Chronic depression.
And then the result of any depression has very, very one-side effect, which all we are scared. And when it's rising for different reasons, is suicide.
Correct.
Okay, so if we don't treat, we don't want to, it's a serious topic. But being a psychiatrist, I always ask my patient, do you ever thought about taking your life?
Correct.
Could be many different reasons, from depression, anxiety, stress, financial problem, whatever it is. But people don't talk about it. They're ashamed to talk about it.
Right.
And it's good to talk about it. Always we should ask it. If you open up, you're able to learn how to deal with it.
Deal with it. Absolutely. So also, I think apart from seeing you and talking about their problems and some medication if they need it, but there are other ways to relieve the stress and anxiety about joining, say, yoga, joining a community event, joining your temple or local church or whatever you want to be involved with to get that anxiety level down, so that you learn this culture and you fit in, but you're still meeting the people that can talk to you how when they came, what happened and how they adjusted. So you use that other aspect of treatment as well.
I always ask them, what are your social activities? What else you do beside your work, your homework, or whatever it's thing. And ask them, encourage them to join the community. There's so many community outlets are there. And I think I'm encouraging people to talk to each other about how they're coping. And it's released when you talk about your problem to other, and you see other person has a similar problem, you feel a little better.
Absolutely.
And then we encourage them to have a relaxation technique. Also tell them to do yoga. Ask them to take some time for yourself to do something, even exercise. We just teach them breathing exercise, which is for yourself. Also, another thing, a lot of people take so much pressure that they have to do so many things. We said, you don't need to do so many things. There are so many Indian people, especially, they take them when they have a guest, they think they need to do everything right. They put a lot of pressure on themselves. So I'm telling my patient,
Especially now summer is coming.
Right.
You're going to have a lot of guests coming.
Yes. So you have to learn. You can do as much you can able to do in your capacity,
Right.
or learn to say no.
Right.
You don't have to really do everything perfect, because you doing all this doing with a lot of stress, taking pressure is on your expense. Don't need to spend. Just take a time, ask for help. If you don't have help, you can ask your guests, okay, can you help me with this?
Correct.
That's okay.
Right.
So take time to relax, take help, learn to say no, join other community, open up the topics, make more friends, and those are, your social aspect is important beside. And if you're taking medication, stick to your regimen, follow your doctor. Again, if you have a question, like it's going to be lifetime or whatever it is, ask that question. Don't have assumption, oh my God, once I'm on medication, this is for me, I have to take it forever. No.
Right.
If you have a side effect, learn to talk about it.
Correct.
Ask to explain. Don't afraid to ask any questions.
Correct. So I think we've covered a lot deal of immigration related stuff, and I think it's going to be of use to a lot of people coming this generation, our younger children, as well as our older parents. Sometimes they come because you sponsor their green card, they come, and it's a big adjustment for them as well, because there the kids are home, here the kids are busy, or you are busy whole day, nobody's there, so they undergo depression because they have themselves whole day. So I think it's a big topic, and there's so much that is affecting us as an individual, as a society, when we uproot ourselves and move to another country with a different socioeconomic, and sometimes it's positive, but they can have some negative effect, and we all can try our best, and the best thing is to be involved with your local community, local events, have friends who have gone through the same thing and talk about it. How did they deal with it? How their kids got adjusted? How their kids' food habits are different, and how they adjusted in school.
Correct.
With the Indian food, because that becomes another stigma. They don't want to take Indian food because it smells, they don't want to eat it. So there's so many other things which we all go, and somehow or the other we have to find a nice balance that we fit in this community, we are not like a sore, but also we keep our identity without becoming completely different people, and then nobody wants to talk. So I think it's a very nice adjustment we all do, and I think we all have done a great deal of, for all these years, I think Indian community, everybody looks up to our community because we have a nice balance with our kids. Most of our kids do great job in academics as well as behavior wise, and I think we should keep up with that. So thank you so much for listening, and this show will be aired again. And also, if your friends and family who do not have access, this show will be on YouTube. You can go to www.youtube.com and type in Dr. Ghosh Show, and you should be able to see this show as well as our previous shows. Thank you and good night.
When your family's in need of medical care, where should you turn? Come to Englewood Hospital, home of the most advanced technologies and medical equipment. Home to Magnet Award-winning nurses who deliver compassionate professional care. And home to more top-rated doctors than any other hospital in North Jersey. For your family's health, come to Englewood Hospital. We're closer than you think.